This is Dr. Michael Tapper from Lenox Hill Hospital in New York, and I'm here with Andrea Ankrum, who is an infection control professional from the Cincinnati Children's Hospital. And Andrea presented a very interesting poster at this meeting about MRSA infections in children with cystic fibrosis, and I'd like to ask her to present some of the fascinating data that she reported at this meeting.
Okay, so what we did from 2014 to 2015 is we collected an MRSA isolate from our CF patient population. They could either have been an inpatient or in our outpatient clinic, and we did whole genome sequencing on these isolates for a variety of reasons, but one of them was to see if any of them were related. I work in infection control, and we're very interested in the transmission of pathogens between our CF patients, especially in the clinic setting and in the inpatient setting. And so we looked at the relatedness of these isolates, and what we came up with was during this time period, none of the new acquisitions of MRSA occurred from any of our CF patients except between siblings, which is what we would kind of expect based on other transmission of MRSA between household members. And so we work very hard in our infection control department in our CF patient population, where there's a lot of processes in place based off the Cystic Fibrosis Foundation guidelines, and we follow them very closely. And so we feel like this is showing that by us following those guidelines, we are preventing transmission in our hospital of MRSA between our CF patients.
Yeah, I was very interested in the guidelines, both in terms of the clonality and the fact that so much of the transmission was clearly linked to household sources, which of course, if you think about it, makes sense, that
Right.
because the children are in such intimate contact. But it speaks not only to the fact of the risk of transmission between siblings, non-CF siblings as well as CF siblings, but it also speaks to the tenacity with which you have followed the infection control guidelines. So I was very impressed in your poster how well you detailed all the guidelines that the CF Foundation has developed. And clearly it seems, at least with respect to this pathogen, that these guidelines are clearly showing some impact in terms of nosocomial or clinic-based transmission. It'll be interesting to see going forward whether some of the guidelines will be as effective when we get to some of the more resistant gram-negative pathogens, right, which, as you were pointing out, seem to be more of a problem as the kids get older with CF, right, beginning with MRSA, but then followed by Pseudomonas aeruginosa and some of the more typical gram-negative pathogens that we all associate with CF kids.
Right, and with MRSA, I mean, now that we have community-acquired MRSA, you can pick it up in daycares and schools. You know, they may be picking this up in the community, and once they get that strain, they keep it. And so it may, since they are colonized with this one particular strain, they are more resistant to picking up strains from other patients. And so that may be a possibility too, is once they become colonized with it, they don't lose that strain, they keep it. And so they're not at risk of picking up MRSA when they come into our clinic because they have already got it from the community.
Right, so I mean the question is, but if they become hospitalized, if they're hospitalized, then they might be at risk for a hospital strain of MRSA, which are
and we haven't seen that where it's been replaced. And so right, since we did serial isolates over a 2-year period on these patients, it is showing that they do keep the same strain. It's not replaced by a different strain.
And most of these are younger children, is that correct?
Right. Typically, I think the average age for our patients in this study were around 11. So some, you know, and I think the range was from 1 to 21. So we do have some older patients that have it too, but it averaged out to be around 11 years old. So it's kind of before they become colonized with some of the gram-negatives, like you say, that this is their first major pathogen that they've picked up.
Are there takeaway lessons from the apparent efficacy of the infection control guidelines in clinical outpatient settings that we need to learn about, both in healthcare, in inpatient settings, and obviously in home care as well?
I think that's one of our biggest challenges is the home setting, because we can only tell them what to do, and then they have to follow through with it. And are they following through with it? We don't know, especially like in their nebulizer cleaning and things like that. How compliant are they with infection control at home? Also, we try to really educate them, give them a lot. The parents, right?
Right.
And at some point,
The kids as they get older.
we actually stratify our education based off of age groups too, because as they get older,
Sure.
they do begin to take care of themselves more, especially as they go into their teenage years. And so we do try to target our education towards different age groups, because we know as they go into their teenage years, they're going to do more high-risk behavior and things like that, and they are going to take care of themselves more. So we are trying to focus on that, but that is really the challenging part. We feel like we've got the clinic and inpatient areas where we really have it under control, but it's that home aspect that we find as a challenge also.
Just another lesson from healthcare moving out into the community, and less and less being done in the healthcare setting in the hospital, more and more of a burden on patients and their support network to take care of themselves, as well as we try to take care of them when they're in our facilities.
Right, because we really, avoiding colonization with these pathogens really helps them, maintain healthy lungs longer, and the more that they can do to try to prevent this from happening, the better it is for them. And so we do try to emphasize that with the parents and the patients, and hopefully, I feel like a lot of them do understand, and they actually become over sensitive to a lot of these. And so when we do mess up at the hospital, because it happens.
They tell you.
Exactly.
Right.
They definitely tell us, like, you were supposed to be doing this and you're not, and so I think that's really, it shows that we are educating them well on what to at least expect in the hospital and clinic setting. So.
Keep up the good work. Thanks so much for joining us today.
Thank you for having me.